Hello, everyone, and welcome to the first workshop in a workshop series on leadership development titled Tell Me More About That. How being curious makes you a better leader. In today's workshop, Lauren Harris from Harris Healthcare Consulting will talk to us about planning and goal setting for 2021. She will explain to us strategic planning and why it is valuable to your RHC, how to create an effective operational plan and identify your practice level and professional goals, and how to create accountability to achieve them. This is a workshop, so we would love your participation. We also hope this gives you an opportunity to connect with other RHC leaders across the state. Once the workshop series is complete, there will be an opportunity to schedule a one-on-one coaching session with Lauren to ensure you take action on your next steps. If you are interested in scheduling a coaching session, send an email to me and I will send you the details and make sure you get scheduled. Lauren is passionate about medical practices and enjoys partnering with them to see them succeed. After years of honing her skills within large and small organizations of multiple specialties, including an RHC and a school-based health center, she started her own consulting practice in July of 2020. She partners directly with practitioners and leaders to provide business and operational expertise. Lauren started her healthcare management career in 1992 and achieved her FACMPE certification in 2008 and her FACMPE certification in 2013. Before we begin, I have a few housekeeping details. This workshop webinar will be recorded. Eric Jordan will post the slides and recording on the Office of Rural Health website within the next few days. A big thank you to Eric, who is our tech support during the workshop. If you encounter technology problems, enter your questions into the chat box and he will assist you. You are all currently muted. I will make sure you're muted once I get done with this. And you can unmute yourself to speak. You can also enter your questions into the chat box. Your video can remain on or off. That's totally up to you. Lauren will be happy to answer questions at any time and welcomes your comments. Without further ado, please welcome Lauren Harris. Lauren, the screen is yours.
All right. Thanks, Rondianne. Can everybody see my PowerPoint in the background? Thumbs up if yes. Okay, super. I see a couple of folks that I've met before. It's really good to see you again. I'm excited to be doing this whole series for you. Today, we're going to start with some conversation around strategic planning and then goal setting, because it's a new year, right? And it's a perfect time to be talking about some of these things. So I will ask you a couple of times for some feedback as we go along. And if you are able to unmute yourself and answer, great. If you'd rather answer in the chat, Rondianne's going to be watching that for me, and Eric is too. So here we go. So we have some objectives for the day. Let me just minimize this other screen. Okay. So first of all, we're going to be talking about what strategic planning is and why it's valuable to your practice. We're also going to learn how to create an effective operational plan with accountability and timelines. And we're going to talk about identifying practice level and professional or personal goals for the year and creating accountability to achieve those. Hopefully you're in the right session today and this is what you were intending to learn. So we had a little poll question going. We'll see if it's functional or not, but I was trying to get the idea of whether folks have experience with this or not. Do we want to try to launch the poll, Rondianne? You're muted, I think.
Yeah, hi everybody, this is Eric. The poll is live. You can see it down at the bottom right. There are 3 buttons down at the bottom right, and one of those buttons has 3 dots in it. If you click on that button, there's something called polling, and it will bring polling up for you.
All right. And then Eric, are you able to share that when we're done capturing that? I can't seem to find it on my screen.
Yes, absolutely.
Thank you so much.
It actually says the poll has ended.
Oh, darn.
Yeah, it does say that. I'm seeing it too.
Well, that's okay. If we just keep going, we keep going. That's all good. All right. Well, let's pretend like you don't know what it is, and we'll just dive right in. And if this is a refresher for some of you, that's okay too. So first, I want to talk about what strategic planning is and tell you a little story. So I spent some experience managing clinics for larger health systems, Providence and Legacy to be exact, and jumped from those roles into running a private practice. And I didn't know the first thing about strategic planning, and I was working with a group of physicians who didn't either. And I will tell you, I purchased this book, Strategic Planning Kit for Dummies. And if you're not familiar with the Dummies books, they are tremendous. They have topics on everything from how to remodel your kitchen to succession planning, strategic planning. It was a tremendous resource. And even though it's not healthcare focused, it was a great way to sort of get me oriented to the process. And I wanted to just share that little tidbit with you. What I've learned is really what it's about is discussing and defining who and where we are today, where we want to go, and how and when we're going to get there. So why is that even important? Why should we talk about these things? Well, these discussions can create a foundation for your everyday decision making and behaviors. They create the ability to be agile because now you have a roadmap. If you've ever gotten in the car and not knowing where you're going, it's really hard to know when you arrive. So if you're having these conversations and you're really discussing them clearly, you'll know what turns you need to take, what routes you need to take, who needs to be involved. And this creates efficiency, focus, alignment, and shared goals for your entire team. And really, it inspires action. So what I've found is doing these types of retreats and these types of conversations, people leave energized and they leave focused and they leave ready to take action. So here are some surprising statistics that I found. So only 42% of American workers can identify their organization's mission, vision, and values. That's a pretty low number. If we're trying to get everybody in the same boat, rowing in the same direction, we should all be aware of what those things are. 95% of a typical workforce doesn't understand the organization's strategy. So again, how can you be expecting people to all be striving for the same goals if they don't know what the strategy is? And 86% of executive teams or leadership teams spend less than an hour a month discussing strategy. Wow, that was pretty surprising to me. But this one's even better. 77% of successful organizations have an established mechanism to translate their strategy into operative terms and evaluate it on a day-to-day basis. So they've discussed it, they've planned for it, they regularly check in about it. 77% of the successful organizations. I want to be in one of those, and I want to work with one of those, and I'm sure you and your teams do too. So how is this relevant if you're part of a large organization? I know some of you are in small clinics, some of you are part of a large health system, rural health clinics. So I wanted to show you that this can be relevant in a lot of different ways. These same concepts can be used at the practice site level, at the clinic care team level, or even clubs and other organizations that are outside of your medical practice. So these concepts can be used universally. And you can use them in conjunction with what already exists in your larger health system if you're part of one. So how do you know even where to start? When do we talk about this? Who should be there? What about a facilitator? What tools do we need to use? And dive into that just a little bit more. So I suggest involving as many stakeholders as possible, especially those folks who are really responsible for managing the implementation and the action plans. You've all heard this before, but it's much easier to get buy-in if you invite the right folks to the table to be part of the conversation. And I also suggest making sure that you have representatives from the top to bottom of an organization in order to get that buy-in. Now, you may not be able to do that in the early stages of these meetings. You may want senior leadership to make some of the higher level decisions, but I highly recommend involving other levels of leadership and workers into these conversations just as soon as you can. So if you're new to this process or you want to remain neutral, I recommend bringing in a consultant. And I don't just say that because this is work that I do as facilitating these things, but I do this, I make this suggestion because it's really difficult to be in both the seat of facilitator and one also who's involved in the final outcome. If you have an outside person or even just someone in your organization who isn't directly involved in what you're trying to achieve, you can get a whole different set of perspectives if you're sitting at the table instead of trying to draw and facilitate in the conversation. So I also want to say that without the element of measuring progress and achievement, the strategic plan is just a document that goes into a file. And I don't know if you have experienced this before, but I have, where a strategic plan was something that the organization did once 3 years ago, 5 years ago, something like that. Maybe a lot of work went into it, maybe just a little bit of work, but it's not real. And it went into a drawer and no one revisited it and no one really understood what the deliverables were. And without that continued focus and accountability, those measurements and those goals that you're setting up, they just won't happen. We all know that. We need things to be top of mind and in front of us. So let's talk a little bit about the mission statement. Early on, we said that strategic planning involves a mission, a vision, and a values. So what is a mission statement? It's really a statement that helps to formulate and formalize what your organization does, why it does it, and who it does it for. It can really keep you on track during decision making. So it answers the questions like, why do we exist? Who do we serve? And how will we improve our patients' lives in the case of healthcare? So I provided a couple examples here for you. There's one from Providence. As expressions of God's healing love, witnessed through the ministry of Jesus, we are steadfast in serving all, especially those who are poor and vulnerable. So you know instantly when you read that mission statement that they are deeply committed to serving the poor and vulnerable and that they're a religious organization. They're not hiding that. They want that to be known. They want that to be demonstrated as who they are as an organization. And here's Kaiser's: to provide high quality, affordable healthcare services and to improve the health of our members and the communities we serve. So again, with Kaiser, you can see that their mission is really bigger than just their small community, but also all of the communities that they serve, and that the fact that they are a fully integrated health system helps them focus on high quality and affordable care. Because as you all know, Kaiser is a health plan and a care delivery system. Any questions on the mission statement for so far? Does anyone want to unmute or put something in the chat or share their mission statement at their organization? I'll wait just a sec.
Hi, everybody. There's an unmute button at the bottom of the screen. It's the leftmost button at the bottom of the screen if you want to unmute yourself.
Thanks, Eric. Appreciate that. I don't know about the rest of you, but I live in Zoom most of the time, and this is a totally different platform for me. So I really appreciate Eric jumping in to help us. And I wanted you to think a little bit about a mission statement. It doesn't have to be, again, at the organization level. It could be a mission statement for your particular care team or your particular site that falls underneath a larger mission statement. Hearing none, we'll keep going. So let's talk about a vision statement. What does that mean? It's the big statement that really sets the goal for the practice. So where are we going? It's this big dream that we have as our organization or as our team. We want to know what we're striving for. Where are we headed? And here's a couple of samples of vision statements. So Mayo Clinic says, we will provide an unparalleled experience as the most trusted partner for healthcare. And what I want to point out about a vision statement is it's lofty, it's huge. It is something that you're constantly striving for, but maybe isn't easily defined. What does this mean as the most trusted partner? That's big language, and that's a big dream that they're sharing. So think about your vision as something that requires continuous striving, not something that you just come to and achieve and move on to the next thing. Here's another example. So Sound Physicians, a group that I found, says our vision is to be the unmatched leader in improving quality and reducing the cost of healthcare for patients in the communities we serve. Again, that's big, lofty language, the unmatched leader. I like that a lot. So you want to make it something that people can strive for and also feel sort of inspired by. These should be inspiring words. Does anyone have comments on a vision statement or want to share their group's vision statement? Again, you can unmute if you want to talk.
Lauren, there is a comment to provide excellence, leadership, and compassion in the enhancement of health for those we serve.
That's actually our mission statement, but the vision statement's new to me.
Yeah, thanks, Leslie. That's great.
Chris Jones has one: to be the first choice for quality, compassionate care, and to lead the way in promoting wellness and improving health in Morrow County.
Fantastic. Great example. Thanks for sharing. Has anybody thought about creating a mission or vision statement for their unique site or team? Hopefully this gets you thinking in just a little different way about how you might utilize these things. All right, well, moving on. The next thing I want to talk about is values. So mission, vision, values. Those are the things we always talk about with strategic planning. But what I want you to think about with values is it's not just about defining them, putting them up on the wall in some beautiful font and some great art. It's really about living them. And what I mean by that is making sure that your organization has values that you tie back to the behaviors of your individuals. So here's some great examples that I've seen in healthcare specifically: quality, justice, integrity, innovation, teamwork, dignity, compassion, respect, honesty, excellence, accountability, community, service, value, reliability. These are, again, big words that mean a lot. And what I like to think about with values is it's something that I can see you demonstrating in your behavior when you work for the organization. So if someone's not demonstrating this, it again gives you the framework to have the right conversations with them. If you're thinking about a performance review, for instance, and you're tying that back to the organization's values, you can use these as definitions and conversation points around, hey, I saw this amazing behavior that you did the other day that demonstrated great compassion for your patient. Thank you for supporting our values in that way. Or something that you did maybe demonstrated going against some of these things. You didn't take accountability for that mistake that you made. And that goes against our values as an organization. That's not who we want to be or how we want to show up, is another way to put it. So I think what's really fascinating about values is oftentimes with organizations, again, we see these big words, we see these beautiful art pieces that people put up on the wall, but we don't see a lot of accountability sometimes to people living them and walking the talk around them. Does anyone want to share their organization's values or any comments that you have around setting them? I told you this was a workshop, so I was hoping for a little bit of input. Or did this strike a chord with anybody?
Well, I can say something. So we're a Plane Tree Hospital. It's our affiliation. And one of the things that we have is in our promise of excellence, we use a lot of the words that you have listed there. And it's CARES is our acronym. And it's compassion, accountability, respect, empowerment, which is the only one I don't see there, and safety.
Fantastic. Do you use any of that language in your performance reviews or in your recruiting process, even when you're talking to potential employees?
Yes, we do. Yeah, it's our focus, actually.
That's cool. That's great. Did I
Lauren?
see another one? Yeah.
Yeah, Orchid Health, value, quality, compassion, and innovation. Values.
Fantastic.
Yeah. Quality, compassion, and innovation.
Got it. How does innovation show up in your practice? Can you share that? That's a great word. What comes to mind for me while she's thinking about that or chatting is if someone brings up something to the organization that they want to try that's maybe a little outside the box, and the first reaction of some of the leadership might be, no, we don't do that. Wouldn't that be cool to have a conversation about, hey, but one of our values is innovation. And this is a really innovative response to some of the problems that we're solving. I mean, this is the kind of ways you can use these tools to ground the conversation and ground the planning that you have in your organization. Any other thoughts on that, Rondian, that you want to share for me? Thanks for doing all of the heavy lifting here. I've got the easy job.
No, there's no more comments. Oh, hold on.
Okay.
Jenny put something else in there. We are continuously challenging the status quo on how we bring healthcare to rural areas, whole person care, and they really do that. They're an excellent little organization.
Yeah. I've seen some of the work you guys do at Orchid. That is pretty amazing. And the resilience that you've demonstrated this last year. Oh my gosh. If that's not a corporate value for you, I don't know what is. But yeah, this is some pretty interesting conversation that you can have. And again, taking this all the way down to the team level. What if your clinical care team or your MA team had conversations around what are our values as a team? How do we want to treat each other? How do we want to show up for each other? And what accountability do we want to demonstrate to one another? This is important stuff. And all of these value conversations tie back to engagement, which is something else that we'll be talking about in our third session. Just looked at my little cheat sheet. So our third session is going to be on employee engagement and team building, and grounding our conversations back into these mission, vision, values guidelines really can make a huge difference in how your workforce feels when they come to work every day and how you feel when you come to work every day as leaders. All right, so let's say you've decided to do this. You want to kick off this conversation or it hasn't been done in a while. What kind of tools would you want to think about using? Brainstorming always is a great way to start, and there's a lot of ways to think about that. I think, Jennifer, before we went live, I could see a giant white sticky note in your background. We're going to show you a slide with giant white sticky notes. I'm a huge fan. But bringing these colored stickies, bringing colored pens, these types of things to the conversation when you're going to do brainstorming can make things much more engaging and more fun. Visioning is another piece of that. One of the tools that I like to talk about a lot that's really common is a SWOT analysis. You may have heard that term before. It's strengths, weaknesses, opportunities, threats. But what it really does is it helps you analyze where your group or your organization is in your community and against your competition. So what you do is you build a model like this where you list the organization's strengths in one box, weaknesses in another, what threats you see from outside forces, and what opportunities you have. So we all know last year was a completely different year than we've ever had before. And now we've turned a corner into a new year. We're faced with all kinds of new threats and opportunities, I think. I've been talking with organizations about, even if you did strategic planning January of last year, you need to do it again because the universe has changed. Our organizations have changed. Our strengths and weaknesses and threats and opportunities have changed. This is a great time to be bringing people together to have these conversations. When I say together, I might mean virtually, and that's okay too. Some of these things you can do remotely. There's some great tech out there that will allow you to do remote meeting facilitation and remote whiteboards and things like that. But this is a really important conversation to be having regularly so that you can identify where you are and what opportunities you have in your particular organization. Has anyone done a SWOT analysis before and want to jump in on this or raise your hand? Nothing? You have such a quiet group. All right. Well, here's another suggestion that I have. Get away from the office if you can. So even if you step into a different conference space than you normally have, some of the groups I worked with have done retreats. You can see this is clearly an off-site retreat at a resort somewhere, giant white sticky notes. Anything you can do to get out of the day-to-day will really help you focus and bring some unique team building opportunities. So it levels the playing field. When you've got yourself in a meeting that is not in a normal setting, along with some leaders in your organization that maybe you don't see outside of the office, it completely changes the vibe. I highly recommend that. And right now, it may mean doing it remotely, like we talked about just a minute ago. That may be the best way to do this. But anything you can do to get out of the office where you have distractions, where somebody is knocking at your door, where your email messages are popping up at you and reminding you, really isolating yourself from those distractions and focusing on this as the work of the day or the days is going to get you the best possible result. And I wanted to show you this slide over here on the or this picture on the lower left. So this was one particular group that I worked with where we were talking about their organizational values and their mission. And you can see giant sticky note, of course, but I loved one of the ones they had on here, which came up really early in the conversation. And it was about tenacity and grit. And that was a value I hadn't seen defined like that in healthcare before, but their organization had gone through a lot of change, a lot of turmoil, and they were still kicking it. They were still moving forward. And they wanted to acknowledge that was important to them, to demonstrate that tenacity and that grit. All right, so that was the first chapter on mission, vision, values, and strategic planning. So now I want to shift gears a little bit. But before I do, are there any questions, any feedback on that first section that you want to discuss more on how to do that formal strategic planning? Okay. Hearing none, I will move on. So chapter 2, creating an effective operational plan with accountability and timelines. So you've done all this foundational work. You've gotten together, you've had the right conversations. What's next? Well, you've got to create some long and short-term goals. Well, what's the best way to do that? I really find that if you look backwards, if you imagine yourself or your organization 5 years in the future and even 1 year in the future, and now you're looking back to today, if you start with that visioning process of who we are in the future, you can work your way backwards. And what I mean by that is that helps you identify the gaps between where you are and where you want to be. So if you've decided that part of your vision is to grow your practice to 2 locations, let's say, something like that, you can imagine yourself 2 years or 5 years in the future having 2 or 3 locations. You imagine yourself now having the 1 location. You can see that gap. You can start to think about what are the operational steps we need to take to bridge that gap. And that's where you can start to dive into the specific actions that you need to take to move you forward. So first do the visioning process of where we are in the future, then ground yourself in where you are today, and then think about creating those specific action steps for how you get there. So here's some questions you can ask yourself to dive a little bit deeper when you're going through this process. What needs to occur to bring out that change? So in the example that I gave of going from 1 location to 3 locations, what do we need to do? What needs to happen to get us there? Who's going to be responsible for those action items now that we've decided that? What's our timeline? So if that's our 5-year plan, where do we want to be at year 2? Where do we want to be at year 3? What resources are we going to need? So money, staff, outside expertise maybe, and which stakeholders need to be kept informed as we start to create this action plan. So if you haven't seen this before, I really like this model around what is a SMART goal. And a SMART goal is a specific, measurable, attainable, relevant, time-bound goal. So as you're setting up these goals for yourself in your practice, make sure that you do it in a way that's SMART. So simply saying, we're going to have that 3rd location by year 5 that's a great lofty goal, but if you don't know what specific steps you need to take to get there, then it's not going to happen. It's going to drop off because it feels too large, right? So think about these things. I think where a lot of people fall down is on this attainable side. Sometimes we set goals for ourselves that are just so lofty, there's no way we can possibly do it. So think about baby steps. Think about little gaps. What's the next action item that you need to take to get you there? And then making sure that it's time bound so that you set yourself a time frame for these steps in the process. That way you'll know if you made it or not, and if you need to adjust your expectations. That's okay to do. It's okay to say we're going to do something in 1 year and not meet it, but then we need to set a new SMART goal for how we are going to meet it the next time. Any questions on SMART goal setting or feedback on that? Has that worked for anybody in the past? This tool can be used too as part of your performance review conversations. So when you're talking to your staff about what goals they're going to be setting for their own professional development, helping them define it as a SMART goal is a really great lesson. I think I saw something pop up for just a sec.
Yeah, Leslie said, we use this regularly in our organization.
Super. Does it work well?
This is awesome. It really is a great tool. Let's see. Kara says, I have used SMART goals and it is very helpful.
Yeah, there are a lot of images of this. If you just do a quick Google search for SMART goal, you can print a pretty color one of these and stick it up somewhere, share it with your team. But I really like the technique a lot. Great. It's good to hear other people using it too. So here's a little example. I know we talked about growing the practice, but here's another thought. So imagine that your 1 year goal is to reduce your staff turnover from 20% down to 10%. You've seen a lot of folks leaving the practice and you want to stop that. Here's some ideas for action steps that you could take. That's a lofty goal, but we need to know what we're going to do to get there. So one of the ideas might be to implement staff satisfaction surveys and creating action plans to address those concerns. So in other words, once we're getting the feedback from our staff, what are we doing with it? And making sure that we are taking steps to mitigate those things that they're reporting back to us that need mitigation. I also like the idea of holding monthly one-on-one meetings with key leaders and or your staff to assess that team engagement and encourage communication. And then the last thing is an idea to create a formal employee engagement program. And like I said, in our third class, we'll talk a little bit about that. But what I wanted you to see here in this context was our goal of reducing staff turnover is a great one, but we need to have specific action steps that we can set SMART goals around in order to achieve. And these don't happen to be in any particular order. They were just sort of a brain dump on my part of ideas and ways that we might address that particular goal. But once you've come to this step, now you can decide the who, what, where, and how, right? So each of these action steps, someone's going to be responsible for. Someone's going to have a timeline to achieve. But first we have to define where we're going and what the steps are to achieve them. Any questions on the example? Hearing none, I'll keep going. So does anybody know what any of those logos are at the top of the page? Jump in if you can, if you know, or if you use any of them right now. We'll talk about them for a minute. Oh, Leslie recognizes OneNote. Awesome. You use OneNote, Leslie?
Yes, we do. And actually, I have to give Tamara some kudos. She beat me to it.
Oh, okay. I missed that one.
No, that's good. That's okay. That's awesome.
Fantastic. These are some fancy applications that you can use for project management. So from left to right, we have Trello, Microsoft OneNote, which comes with the Microsoft package that a lot of us get when we use Microsoft, Asana, Smartsheet, and Monday. These are some of the most popular project management tools. I have used a little bit of Asana and a lot of OneNote, but my favorite is Excel. And I am comfortable in Excel, and I want to show you something that I've created to track project planning that you may want to adopt as well, because you probably have access to Excel. Most of us do. And some of these other applications can be a little bit harder for you to get. So I know this is a lot of information. I'm going to go over it from top to bottom and show you what I mean. But I am grounded, as we said in the introduction, in the MGMA ACMPE body of knowledge. So MGMA has a certification process for practice managers, but around that, they focus on currently 6 domains, and they are financial management, HR, operations, transformative healthcare delivery, organizational governance, risk, and compliance. And having gone through that certification process and mentored others through it, my brain now sort of works in those categories. So what that means is when I'm looking at creating an operational plan in an organization, I'm thinking about what categories or what domains those might fall into. And that naturally helps me put them into different boxes or buckets. So what I've created here is an Excel spreadsheet. This is just a screenshot of one with the specific goals down one side, the domain here, the primary accountable person, if there are any co-accountable people, any additional resources that might be needed, and then that due date so that we, again, set these with time-bound restrictions. So just as an example, this was one group that I worked with where we were looking at their coding patterns and whether or not the group needed to bring on a certified coder. And so we talked about that. It was something that we didn't decide in the strategic planning retreat, but we put it on our operational plan. So we were going to research the need for that CPC staff position. And that fell into the HR domain. There was one particular person who was primarily accountable and a different person who was additionally accountable. And when we were done with it, we marked it done. So what I love about Excel is you can sort by these columns when you set it up this way. So if you just want to see everything that Jen's responsible for, or everything that's financial management, or sort by the due date, Excel is amazingly versatile in this way. Any questions about this format or any thoughts on doing something like this? Nothing's popping up. Okay. Another thing I wanted to say about this is then this can drill down. So then Jen can take this list. You can see she had several things she was responsible for. We had 2 Jens in the group, and create her own Excel spreadsheet that was the operational plan specifically for items that Jen was responsible for. And then she would drill down even into more detail. I think I saw a comment pop up.
Yes, you did, from Tamara. I have used spreadsheets like that for projects before. It is very helpful to stay so organized.
Totally agree. And what I love about this too is it creates that accountability. We can always go back and say, what were we going to do? Who was going to do it? And did we meet the deadline? And the other thing I wanted to mention is we often forget to celebrate when we get things done. We just sort of move on. This is kind of the way we are, especially in healthcare where things are just coming at us all the time. I love the concept of taking a moment in your meetings, at every meeting, and revisiting the done items and discussing them and celebrating them and taking a moment to acknowledge the people who've done the work to accomplish the goals. And this tool can be used really easily for that too. So I just wanted to show you that it's not, you don't have to invest in a fancy software. You can if you want to, but you can do this really simply in an Excel format that's very user-friendly, that most people know how to play with, and that it's easy to sort and manipulate over time. So like we talked about in the beginning, what's really important about this is getting the word out. It doesn't do you any good to do all of this work, to sit in your leadership team meetings and then to file it away in a drawer. You have to make this relevant to the rest of the group. So as a quick reminder, if you want to ensure that all the people in your organization are on board with the new strategy, you should be able to fit it in one page. And what I mean by that is your strategic plan should fit on an OPSP, a one-page strategic plan. So it should be in a way that's easily understood and easily digestible by members of the entire workforce. Now, that operational plan that we just talked about, that's going to be more specifically for the people that are doing those individual items. This is how you get the big picture out to the rest of the group. So if you include your mission and vision statements, and maybe even values if you have room for those, that's wonderful to put on the one page, as well as some of your top goals, the things you want to get your team really to buy in on. I recommend putting those long and short-term goals that you can into a one-sheet page that everyone can see. So something visual, like we talked about printing that smart sheet or that smart goal sheet and having it around in front of you, creating an OPSP and having it available to the team to see. And as part of this, you're going to be answering the questions like we did a minute ago in the who, what, when, where, how, and why. We're going to accomplish each of those things that we agreed to. And I also wanted to include this because sometimes we get things in our operational plan that don't add a lot of value. And it can be hard to have the right conversations with the right people, but ask yourself, as you're putting these goals together and as you're creating these action steps, should we do this? And why? Why is this important? Are we really focusing our energies and our dollars where we should be? And then listing those action plans and responsibilities as much as you can, as well as those timeframes, so everybody knows where we're headed and what we're trying to achieve. So I jumped ahead a bit, but any closing thoughts on chapter 2? Creating that operational plan. Nothing yet. Okay. So we've kind of gone from up here, the really high level view of strategic planning. What is it? What's included in it? Down to creating an operational plan that is specific, that the whole team understands, that everybody's working toward the same thing. And the last thing I wanted to talk about was creating some professional and personal goals. So again, first of the new year, this is a great time to be thinking about how you are leading and how you are showing up and what is important to you for this next year. So I wanted to give you some tools and ideas that I've absorbed over the years. This is one of my favorite leadership coaches. Her name is Mary Lee Gannon, and she has a website. So I put her little name at the bottom here, but I'm going to be sharing some of Mary Lee Gannon's tools here. So a few questions to dig deeper at the first part of the year. I recommend pulling out a piece of paper or a journal and asking yourself these things. So what happened this past year in my career? What happened in the past year with my relationships? What happened in the past year with my personal growth and mindset? What happened in the past year with knowledge growth? And what happened in the past year with health and wellness? So writing all of those things down. What's happened? Just observing, just looking back, making a mark as to what all those occurrences were. And then asking yourself, how do I feel about this? And what insight do I see with these things? So just taking an outsider's view of looking back at the last year, and then taking an insider's view of how do those things make me feel? And what insight can I gather by looking at each of these questions? And then asking yourself, what do I need right now and in the coming year? And what do I need for myself? What do I need from others? And what's in the way? So thinking about if that's what I'm needing or where I'm needing to go, what are the roadblocks that I'm seeing that I need to be able to eliminate? And what will I eliminate? So it's just a simple idea of thinking around personal goals. If I need to eat less junk food, well, I need to eliminate the junk food in my pantry, right? I need to get rid of it. If it's not available, I'm not going to be able to eat it, and I'm not going to buy any more of it. So that's just a silly little example, but thinking in sort of the larger terms of what's in the way of me getting exercise every day? What do I need to eliminate off my calendar that's not adding value? Are there specific appointments or meetings that feel like they are not helping us contribute our time effectively to what we've agreed that the bigger goal is? And then what do I need more of? This is a great question. I love this. So if I need more connection with other humans because I've been working remotely all the time, then I need to set myself a goal to create those opportunities. So thinking about those types of things, what do I need to get rid of and what do I need to do more of? And then what beliefs am I holding on to? And not judging them, but asking yourself, are they productive or not? Are these things that are adding value, these beliefs? Do I need to think about changing some of my beliefs? Are they beliefs about people? Are they beliefs about my work or my organization or my personal life, my relationships? This is big stuff, but it's extremely valuable. And then I love this one. Is there one thing, or what is the one thing I can do that makes everything else easier or unnecessary? And it can be something simple. It can be, I really need to get a new smartphone because my old one is always shutting off the battery side. I mean, it can be something as simple as that, or it can be something much bigger than that, but trying to identify what that one thing is that's getting in your way. And I believe you can get a copy of this presentation too if you'd like these questions later. So I know there's a lot of great ones here. So I have a little picture of a journal here for you, just thinking about encouraging you to take time for yourself and to do some of these workshop questions in your own journal, in your own space, when you have time to really focus and think. But I love this idea of writing down, what are 5 things I want to be in the next year? That's a big question. And what are 5 things I want to do in the next year? And what are 5 things I want to have in the next year? Those can be tangible items or they can be intangible things. Did any of these resonate with anyone? Good. So to summarize, we're coming up on the end. Strategic planning and goal setting are really important activities that can help you decide where you're going, who needs to come along, and celebrate your arrival. So I love this picture because really it sort of exemplifies the journey that we're all on, and how we can be planful about the trip that we're all taking. And work every day is a journey that we're all on together. And there are specific milestones that we're going to want to achieve together. So I had a poll question at the end, just curious about learning. I don't know if we can pull this one up at all, but if we can, it'd be great. I'd love to get a little bit of feedback from you about whether you found this valuable and interesting.
Lauren,
what do you think?
We can't pull it up. If you
Okay.
could give the ball to Eric, then he might be able to pull it up.
Let's see. I have to see if I can find Eric. Okay. There you are. All right. Did this work, Eric? Can you do anything with that?
Yeah, let's see here.
Lauren, I do have a question.
Yeah, fire away.
So, as important as this is, it's still time consuming.
Mm.
So, do you have ideas to streamline this strategic planning process?
Yeah, great question. I do. And I think, especially now as we're thinking about moving this into different settings than we've ever done this before, a 2-day retreat doesn't make sense like it used to. I think it's easy to break this into chapters. What if you had a 2-hour meeting where you just discussed your mission? What if you had a 2-hour meeting or even a 1-hour meeting where you talked about your vision? I think the key is to set aside some specific time with the right people in the room to discuss these. And you can break it down. You can start the conversation, stop, and bring it back again. It doesn't have to all occur in one day or 1 2-day retreat or anything like that. So does that make sense? Does that feel like it's more doable to break it into smaller pieces?
Yes, absolutely. Leslie is also says, this has been a good reminder. This past year, so much has changed that it was easy to lose track of our goals.
Completely. And our goals have changed. I mean, let's be honest about that. We have completely different things that we are now striving for, and completely different directions that many of our organizations are headed now, and different priorities. And that's why I think if you can be the champion in your organization, big or small, to revisit these conversations and to say, hey, it's really time for us to talk about these things again. And even breaking it into smaller chapters, like we talked about, would be incredibly valuable. The key is to, again, get everybody on the same page so that we're all in agreement about what our foundation is and where we're headed. Without those pieces, we're all just individuals trying to do what we think is best. And that includes our team. So, your team comes to work every day doing what they think they need to achieve. But if you can give them some direction, some clearly defined things that we're all working toward together, you'll have those opportunities to know when you get there, and again, to celebrate, to not forget to celebrate. Oh, there's another comment from Jennifer. So this is great being a new supervisor during this past year with COVID, losing track of goals. Yeah, absolutely. So my hope for today was really just to ground everyone in the fact that this is actionable. It feels huge, but doesn't have to be. And just because it feels like it's something that happens up here maybe, doesn't mean you can't bring it down to your own individual team level. And to encourage everybody to really get serious about writing things down. And I was talking to a practice leader the other day, and she said, I feel like my job right now is just to document my job. And I said, in some ways, at times, that is your job. You're the team leader. You are the one that's setting the direction and that's documenting all of that in order to keep everybody on task and keep everybody going in the same direction. And it can be hard when you're down in the weeds and you're the one writing the COVID policy and all of that. But it's important to take a moment, even if you take an hour a day, half hour a day, to pull up your operational goal spreadsheet and your personal goal spreadsheet and say, am I on task? Check in with yourself, check in with your team. Where are you at with these things that we agreed we were going to deliver to one another? Any luck on the poll? It's okay if not.
Eric?
Yeah, so it looks like a closed
saying...
poll. Yeah, a closed poll is a closed poll. The only option I have is to start a whole brand new poll. But it should be visible to everybody so that you can see the questions. There are only, in reality, there should only be 2 questions present, but there are 5.
Yeah, question 5, what I was really aiming for is a little bit of feedback about whether you learned one new thing or multiple new things or didn't learn any new things, but maybe this was just a good refresher. Just taking the temperature there to know if I was on the right track. Thanks, Eric, I appreciate that. Good refresher, okay, awesome. Jennifer learned something new, awesome. The SMART goal method was new. Great, great. Thank you for responding in the chat. Appreciate that. So I'm going to share just one more thing here. Can I take the ball back for a second? Okay, so my contact information here. I want to just put something out there to all of you that it is really my passion to help leaders like you grow and develop and become the best that you can be at your job and the most satisfied that you can be in the work that you do. So our next topic is coming up on February 11th. We're going to do these every 2 weeks. You probably saw that already. But the concept's going to be how to develop from manager into leader and really what those differences are And here's a few ways that you can get a hold of me too. I have an email, I have a LinkedIn, and then a business Facebook page too. But just so that you know, I also want you to be comfortable with reaching out to me with questions, or if you need a coach, if you need someone to just stand behind you or to say, no, you're not crazy when your doctor asked you to do this other thing and you knew in your gut that wasn't the right thing to do. I'm happy to be that person. The joy that I get from being self-employed is flexibility and being able to support all of you in a way that I couldn't do if I had, you know, a different sort of role. So I hope we get a chance to get to know each other a little better over the next 4 sessions, because we have 5 altogether, and just encouraging you to reach out and connect so that we can develop our relationship together. So that's how I wanted to end today. I hope this was a valuable use of your time. It's in my heart that you walk away with something tangible, something that you can actually implement. And yeah, I hope you got that out of today. Any closing thoughts, Rondianne?
Thank you very much for presenting this workshop. And just a reminder that there are 4 more workshops left, and I will send out an email next week with a link to the second webinar. And thanks everyone for attending today. And
all right, perfect timing. It looks like 12:57 on my clock, so you all can get back to work right on time.
Okay. Thank you very much.
Thanks, everybody. I'm so glad you could be here. Oh, hi, Christy. I recognize your name too. Good to see you. Great. Thanks, everyone. I look forward to our next session together.